Good afternoon, everyone. Thank you for joining us. So, like what Iskandar has shared, I think just to give some background context to this this discussion. So during the pandemic, we have seen it has exposed the shortcomings of Malaysia's social protection system. So we have seen the impact of several months of MCO, then CMCO, then RMCO, how it has impacted the economy. So with restrictions of mobility and operation of economic sectors, we see that our GDP dropped 17.1% year-on-year in Q2 of 2020. So the finance minister also yesterday said that during the budget that early estimate of Q3 indicate an encouraging growth trend. So in terms of unemployment rate, we also saw an increase of unemployment from 3.3% in January to 5.3% in May, which is the highest so far. Although the unemployment rate has decreased to 4.7% in August. So the question is, how do we protect lives and livelihood in the time of crisis? So Malaysia has announced a series of stimulus packages, starting from the economic stimulus package announced by the Pakatan Harapan government, and then continue by the additional measures announced by Perikatan National Government, followed by Prihatin package. We have Prihatin Plus with focus more on the social assistance. Then Penjana was announced with more focus on economic recovery, and then Pita Prihatin. So we also see that in the budget yesterday, there's quite a significant number of measures announced. Among them are the cash transfer program Bantuan Prihatin Rakyat, targeting children from lower income households and singles with income of 2,500 or less. We also see a targeted moratorium, as well as a withdrawal of account 1 of EPS for 500 per month for 12 months. We also see an extension of the job search allowance. Besides that, also in terms of the generating and retaining jobs, we do see the program Penjara Kerjaya to provide incentives to employers to employ disabled persons with disabilities and also long-term unemployed and also the retrenched workers. And we see reskilling and upskilling programs of up to 1 billion, and also the extension of wage subsidies for the tourism sector. Yeah, then we also have some others program for women in terms of microcredit and also in terms of one-stop centers for domestic abuse. So this session, we're going to discuss on, will this pandemic spur the government to strengthen social protection for Malaysians so they can better cope with future economic crisis? And which are the communities that are most vulnerable, that are in great need of attention? And how can government cooperate with private citizens, communities, and civil society to achieve better social protection? And the last question we want to address as well is, were the measures announced in Budget 2021 sufficient or ineffective? So I will now introduce the panelists before they make their opening remarks. So each panelist will speak around 10 minutes. And please ask your question via the Q&A box. I think there's the two box. One is for the chat and one is for Q&A. Please ask your questions in the Q&A box and also introduce yourself. And if you have a question directed to any of the panelists, please specify in your question. As we have a lot to cover within a time frame, appreciate if you keep your questions concise. And I also apologize in advance if we do not have enough time to address all the questions. So now with Prof on the video now. So now I want to introduce our first panelist, Prof. Dato Norma Mansor. Prof. Norma is the Director of Social Wellbeing Research Center at the Faculty of Economics Administration, University of Malaya, a position she holds since 2013. Prior to this, she was the Dean of the Faculty of Economics and Administration from April 2004 to June 2009. Among her notable appointments were Secretary of the National Economic Advisory Council in Prime Minister's Department, advisor and consultant to various organizations, which include the National Institute of Public Administration, Intan, Sarawak Economic Development Corporation, the United Nations Development Programme, World Bank, International Labour Organization, Organization for Economic Cooperation and Development, and the European Union. As an academic, Dr. Norma has written extensively in books and scholarly journals. She holds a PhD and Master's from the University of Liverpool and a Bachelor of Economics degree from University of Malaya. Her research interest includes public policy, governance, and social protection. In recognition of her contributions, Professor Dato Norma was awarded Emeritus Professorship by the University of Malaya at the October 2018 convocation. So Professor Norma is also the President of the Malaysian Economic Association. Over to you, Professor.
Thank you. Thank you, Ya Shin, for such a kind introduction. Assalamualaikum and a very good afternoon. Thank you to IDS for having me here and giving me the opportunity to share what I think, not just about the budget, but about social protection in general, because our center is specifically established through an endowment provided by the EPF to advance research in social insurance and also social protection, which is the wider aspect of it. Yeah. Linking social protection to the budget announced last night or yesterday, there are many good elements in the budget on social protection. And it is about addressing both the current issues dealing with the COVID-19 pandemic and also preparing the economy for the recovery. With regards to social protection, there are improvements in terms of extending the net and also improving on the adequacy, which is the amount given to the recipients. And there are signs of better reception among Malaysians for a stronger social protection. Yeah? If I can start by sharing on how social protection can be guided by three main principles. These are practiced in other countries, and the evidence shows that these three guiding principles are something that we have to remember when we are designing a social protection program. These three elements are: number one is about coverage. Is the extent of the coverage. Who do you want to cover? It can be across sectors, the formal sector, the informal sector, the daily wage workers, women, children, disabled, and the elderly. Yeah. So who do you want to cover? Do you want to cover everyone? Or you are just focusing on one single sector or a few sectors in the society? Secondly, is about adequacy. Adequacy is how much you want to spend, or how much should you give? How much is enough per month? Yeah. Or in some cases, you give a one-time payment. Yeah. Is that adequate? So whether it's high or whether it's low. The third principle is about the cost. What is the appetite? What is the fiscal space? What are the different models out there that you can use? Now, in general, just like any other public policy, you can have some of these principles, they are conflicting. You're trying to achieve one objective, it can be conflicting with the other objective. In terms of social protection, it's the same. You can have the two. You can have wider coverage with high, what do you call, high payment, high sum, yeah? But the cost will be very high. So can the country afford that? Or you can have because you do not have enough or you do not want to increase the cost, then you have less, you give less amount, but to more people, or to more people, less amount. So in many countries, the combination or the mix of this is what they go for. So we have seen that in Malaysia, yeah, when you talk about coverage, yesterday the government was talking about addressing, if you can see from the social assistance and all that, it was altogether, I think, 28 billion, yeah, that was allocated for the cost of living for the welfare of vulnerable groups. But do we cover everyone? And this is about 1.6% of the GDP. Yeah? So I will also come back to what are the good elements in there. But when we talk about coverage, you talk about adults in Malaysia, there are altogether 22 million people. 22 million from the ages of 15 years old to 64 years old. Now, EPF covers 7.2 million. The civil service, you can say that about 1.6 million covered by PUA. And perhaps you have another million that is studying in tertiary education or undergoing some, what do you call that, training, etc. So you are talking about 40% of the population that is covered. Yeah? The 60% is not covered by any social insurance or any kind of protection. Yeah? So what the government was trying to do in this budget is to include more people. I can see that. That's what I mean by the good element. There are more people that the government is trying to cover. But are we covering enough? Yeah. So that's a question that perhaps will come back later. Now, the second point is about adequacy. Now, in 2018, yeah, in 2018, and I don't think these figures changed very much. Yeah, the EPF figures shows that at the age of 55, two-thirds of the EPF contributors have less than 50,000 ringgit in their in the savings or with EPF. So, and many of them within 5 years, yeah, they would withdraw or they used up all the savings that they have. Now, so this is the issue of adequacy, that whether the social insurance that we have, which is contributory, yeah. So this is another element that I can talk about in the way how we manage the cost, or we manage how we want to the resources that we can use, yeah. So they would use it, and yet, okay, maybe in the 1950s, the people only live until the age of 60, yeah. But now people are living until the age of 77. Some are going into 80s, 90s, and even in the hundreds. So if you, for the next 20 over years, if you have finished your EPF savings, what are you going to live on? Yeah. So COVID-19 is talking about how even when some kind of crisis like this happens, we are already at a loss. So something is not right there when we talk about social protection. And the cost, yeah, the cost can be to the government and can be to individuals. We are talking about how there's a synergy between the tax-funded and the individual contribution can support Malaysians in general in times of crisis. So we have a model that we feel that should be good. We should create a fund for this that can be what we call in social protection literature, we call it a funded system. Funded system is like the EPF or QA, where the return from the investment will be used to finance social protection, yeah? So that we can reduce the burden of everything coming from the tax. But for the low income, there should be some initial amount coming from the tax funded that you would allocate for social protection. So this kind of synergy would allow social protection to cover more people and also to cover the rest of the years that people will have, that generally Malaysians live longer nowadays. Yeah. So now the government, not just the Malaysian government, but all governments in general are under pressure. Yeah, either to give more or to for individuals, to allow individuals to withdraw from the EPF and all that. So if the government can yield to what we call populism or the populist, yeah, to what the public wants, but the government will also have to come back to why. For instance, what is the mandate of EPF? Yeah, what is the mandate of EPF, and are we knowing this crisis? And of course, in the recent years, this is the first time that we are facing this unprecedented. Yeah. So, and now we are tested, and we know that our current social protection system cannot support us when we have a crisis like this. We've had our economic crisis in the past, and we had some systems in. For instance, the employment insurance system was the result of how vulnerable we were in 1997 when we did not have the employment insurance system, where everything has to come from the tax from the government. Yeah, but now with EIS, at least for job search allowance, it doesn't have to come from the government. You have that funded system that you have. So for now, for instance, this is the time that we should think of social protection in a more holistic manner, more long-term, but not to give in to the populist or the demand. Because let me just say this, that some people will be happy with some of these initiatives. Some people are not. People are talking about what is the role of government if it's not to support people when in times of risks. Yeah. So there are other means that perhaps we can look at, but the short term is one has to balance between responding to short-term challenges and going for more long-term and more sustainable type of approach. Yeah, thank you. I will just end here for now.
Thank you, Prof. Norma. Just got a question on that. I think you mentioned about during crisis and normal times. So in terms of that, is there a distinction between social protection during a normal time and also social protection during crisis? Is there a different kind of measures, or how should government respond to that? Is it different in terms of like social safety net to ensure that people don't fall into destitute during?
Social protection should be for all times. Yeah, should be for all times. But in times of, because social protection is basically protecting you against risks. It can be any kind of risk. It can be economic crisis. It can be climate change. Yeah, it can be this kind of crisis, any type of crisis. But of course, during crisis, you have an add-on because they would need, I mean, all countries, even countries with good social protection system, do have additional support, financial support that they will give to the citizens. Yeah, thank you.
All right, thank you, Prof. So next up, we have Nurhisham Hussein. He is the Chief Strategy Officer of the Employees Provident Fund, EPF, leading its strategy division, which includes the strategy management, people matters, and corporate affairs departments, as well as the EPF Learning Campus. So prior to this role, Nurhisham was the head of EPF's Economics and Capital Markets Department, where he oversaw the economic surveillance of over 20 economies across the globe, contributing to the investment process at the EPF. Nurhisham began his career in merchant banking in the 1990s and has held several economics and strategy-related roles with various financial institutions, including Pervira Affin Bank, Permodalan Nasional Berhad, PNB, and the Malaysian Rating Corporation Berhad. He holds a Bachelor of Science in Monetary Economics from the London School of Economics and Political Science, and a Master's in Economics from the University of Malaya. Over to you, Nurhisham.
Thank you, Ya Shin, and thank you to Ideas for inviting me. I'm going to amplify a bit on what Dato Norma said, but also rather than really directly addressing the budget, I'd like to talk more about some of the challenges in terms of implementing social protection during this crisis, which has been so highly unusual. I think we have to really realize that what has happened with COVID has been really unprecedented. It's a once in, I just told this to my CEO the other day, this is a once in 3 generation type of crisis. It's not the kind of thing that, the typical economic crisis that we've run into in the past. And the measures that we have had to take, not just in Malaysia, but I think around the world, has also been highly unusual and it's very tailored towards the health requirements of this crisis. In nowhere, I mean, I've been involved in business continuity planning and risk management planning and all that. In none of our scenarios did we imagine there would be a situation where everybody will be locked up at home. And that, I think, has been one of the biggest challenges, and the reason why I think a lot of the policy responses have also been highly unusual and extremely expansive. And I think that there's not much difference in that sense with what's happened elsewhere and what has happened in Malaysia. But I think in our situation, the challenges have been compounded by the fact that we've already had a lot of gaps in our social protection system. There has been some movement towards reform in recent years, but having said that, there's still a lot of gaps, especially in terms of coverage, especially in terms of adequacy, as Dato mentioned just now. I think the key aspect of it is that our social protection system in Malaysia is outside the healthcare system, is primarily employment-based. Even when we talk about health insurance, it's also employment-based. You pay your EPF contribution, you pay your SWRC contribution, it all comes from salaried workers. And as Prof mentioned, 60% of Malaysian adults aren't covered by any system at all. And in that sense, I think that's where the biggest gaps actually are. And that posed a massive challenge, I think, when the time came, especially when we've had discussions with both EPU as well as MOF through March and April. The biggest challenge was actually figuring out, okay, how do we deliver protection to people when we don't know who they are, where they are, and what they're doing, right? For people under the EPF system, if you're under the employment insurance system, we know who you are. The system's out there. The coverage is there. Even if you talk about lack of adequacy and things like that, at least there is some kind of coverage. But outside of that ring-fenced area, I mean, there's a lot of massive challenge in terms of getting assistance to people. And I can't say that we've made a great deal of progress in actually solving that yet. It boils down to a lack of data, and it boils down to a lack of, I think, really consolidating data, because right now social protection is actually spread across multiple agencies and multiple ministries, and we all have our own little databases. So from Negara in terms of banking access, EPF in terms of, and SWRC in terms of salaries. We have IKASE, which covers the hardcore poor. But then, there's this gap between those who are really in the hardcore poor versus those who are working, or at least in salaried employment. And that's in the informal sector. And this is a sector that's been growing a great deal in the past decade. But there's really, not a whole lot of data on what their situation actually is. And in any case, even if we look at those people that we can categorize, it's not a static population. I mean, we're used to talking about T20, M40, B40. But the reality is that those concepts are actually quite fluid. If I'm a pilot earning 30,000 ringgit and then I'm not flying anymore and I'm on no paid leave while the planes are flying, then technically I'm B40 already. I'm not earning anything. I mean, that's some of the kind of implementation, I think, challenges that government has faced, especially over the last few months. Also, I think there's this big inequality, I think, not just between the formal sector and informal sector, but also between large companies and big companies. When you talk about employment in large companies, it's fairly straightforward. When dealing with corporate HRs and the like, again, we can kind of identify where people are, what their situation is and the like. So, for example, if you get a salary cut or what have you, it's fairly easy to report. But the majority of the population actually works in SMEs. And there, in terms of trying to find out what's going on there, it's extremely hard. I think DOSM has been running monthly surveys trying to figure out, okay, what's going on the ground. And some of that feedback has come back to the government. But a survey is not a census. You can figure out general trends, but you can't identify those people who actually need help. And there's also things like, again, a challenge in terms of categorization. How do you differentiate between somebody who's self-employed versus a micro enterprise versus somebody who's just working on site? I mean, you just take the example of the Machikia in the Prihatin budget. So if you're a pisang goreng seller on the roadside, right? You would be classified as self-employed, right? But if you employ somebody to help you, then you're a micro enterprise. And the kind of assistance that the government gives to these different categories is going to be different, and the magnitude is going to be different just because of that simple change. So those are the kinds of things that we are still grappling with in terms of fixing, I think, for social protection for the future. So I think those are the key areas, I think, in terms of actually managing social protection during a crisis. There's lack of data on vulnerable groups. We don't have automatic systems to actually funnel or deliver social assistance in a timely manner to the people who need it, right? And as a result, we're doing a lot of things on an ad hoc basis. Now, the role of SOCSO is well defined, the role of EPF is well defined, but we're having to step out of our mandates because there's nothing else that's available, right? And while we're doing the best we can, we're not exactly equipped for that. And the purpose of what we're doing could be lost as we're trying to help our members survive this difficult time. So I think just to close with a couple of remarks on the budget. One, I think there's a lot of measures in the budget that deal with social protection, but really, as I said, we're doing things on an ad hoc basis because of the lack of that institutional framework in terms of the lack of a holistic system of social protection. And that's something that we need to fix before we get hit by the next crisis. So where EPF lies in that, our role is primarily retirement savings. We should not be treated as emergency savings. I know that we've allowed a lot of latitude simply because nobody else can play that role, but we really need to revisit, okay, what is the role of EPF going into the future? What kind of social protection system that we need to cover the vulnerable groups in the future, so that you don't jeopardize your future for the present. So I'll end there. Thank you so much.
Thank you, Engineer Nurhisham. Yeah. Just on the note that you were talking about timely delivery, from your perspective in terms of outreach to the poor and vulnerable, in terms of the stimulus package, do you have any idea how's the outreach like in the coverage of impact of these packages?
I think in terms of the cash transfers, it's okay because the mechanism was already in place. So that could be done very quickly. But for example, when we did Lestari, the account to withdrawal in April, it took us 6 weeks to almost 2 months to actually come up with it, because we had to change the systems. We had to come up with the processes. We had to all of it was on an ad hoc, really on an emergency kind of basis. Whereas if we had a holistic system, it would automatically kick in anytime somebody ran into trouble. And I think that's the kind of future that we're actually aiming for. So I would say that's part of EPF's aspirations in terms of, the future of social protection in Malaysia, where, we don't have to do emergency ad hoc measures just to cover those who are actually in need.
Thank you. So I will now introduce our third panelist, Dr. Narimah Awin. She is the Technical Advisor to UNFPA Malaysia. Dr. Narimah obtained her MBBS degree from India in 1976 and Masters in Public Health from the Philippines in 1982. After serving the government of Malaysia and the Ministry of Health for almost 30 years in various positions, she retired as Director of Family Health Development in January 2007. Then she joined the World Health Organization, WHO, as Regional Advisor for Maternal and Reproductive Health. First in the Regional Office for Western Pacific in Manila, and then in Regional Office for Southeast Asia in New Delhi, where she retired in 2013. After retirement from WHO, Dr. Narimah serves as International Consultant for Maternal, Reproductive and Sexual Health in WHO Myanmar and in Child Health Development in UNICEF Myanmar. From March 2019 to June 2020, she served as Chairman of the National Population and Family Development Board. And in July 2020, she is recruited by UNFPA Country Office Malaysia as Technical Advisor for Sexual Reproductive Health to provide technical assistance in sexual reproductive health and rights. Over to you, Dr. Narimah.
Thank you very much, Ya Shin. I would like to first of all say a big thank you to IDEAS for inviting me to be in this conference. As Ya Shin said, I'm now the technical advisor to the UNFPA in Malaysia. And as you know, UNFPA is the UN agency whose mandate is on population dynamics that includes aging, but the main area of work is on sexual reproductive health, and that includes women and gender issues. And of course, we pay particular attention to young people and adolescents, including adolescent sexual reproductive health. In fact, when COVID began, not long after the pandemic, the United Nations country team, we did a report. It is called, you can see it here. It is called the Socio-Economic, a UN Socio-Economic COVID-19 Response Plan for Malaysia. So it's a very comprehensive plan, and the United Nations country team has suggested or offered 7 areas of support to the government if the government so wishes. Now, yesterday's budget, as expected, I think we all knew there would be bouquets and brickbats. There's a lot of praises, there's a lot of criticisms, and I know for sure, having retired from the Ministry of Health, I was particularly disappointed, and all my colleagues in the Ministry of Health are really very, very disappointed about what the Ministry of Health has been given. Of course, I am more interested for today's session, more interested to look at social protection, and both Dato Norma and Nurhisham has given us a very, very good background of social protection. I learned a lot from both of you. Now, in May this year, after the COVID started, we, UNFPA, whose mandate I told you is family, population, women, gender, and UNICEF, whose mandate is of course children, the two of us, UNICEF and UNFPA, we commissioned a local researcher to conduct a survey on the impact of COVID and MCO during the MCO and after the MCO. So the survey was conducted, the first one was around May, June, and the second one was in September. Of course, later on we got the second spike and there was CMCO again. So we have this report, we call it Families on Age, because this is particularly addressing the impact of COVID and MCO on low-income families. It's a sample size of 500 families who live in 16 low-cost PPR flats in Kuala Lumpur. And so they were interviewing the heads of household. More than 20%, about 20-25% of the heads of household were women, were female-headed household. And that's where my interest is, because that's what UNFPA is all about, women's issues. Now, this Family on Age report, you can jolly well understand. The first one in May is to see how it affected them, the impact. And in September, we were expecting some changes. We wanted to see, hopefully there were positive changes after 3 or 4 months. There are so many details in that report. In the 7 or 8 minutes I have with me, it's not practical for me to cover all of the findings. Most of it is, of course, on the economics and financial situation of these low-income families. I can summarize it by saying, as you would already know, that these families were severely affected. The income levels were reduced considerably in May. And lo and behold, in September, we were quite pleased to see there has been some recovery, but not enough. Very little recovery, whatever it is way below before the COVID times. And a very, very, to me, a very revealing, also a rather sad finding was that when you ask them, how do you think your economy, your financial status will be 6 months from now? Will it improve? Will it become worse in the next 6 months? Let me check the findings for you. 20% of the male heads of a house said it will be the same. 17% of the women said it will be the same. As far as will it be better, I'm sure you wouldn't be surprised, only 10% of the men said, yes, I think it will be better. And for the women, only 2% said they feel it could be better. As for whether it will be worse, 40% of men said it will be worse, and 50% of the female-headed households said it will be worse. So it is very bleak, and we are not surprised. Now, that 20 or 25% women who are heading the household, that's where my interest is, carrying the mandate of UNFPA, they really face many, many challenges. I think it's disproportionate to what they should be experiencing. Because of the loss of income, of course that affects both the men and the women, but the women themselves who are working are now not working anymore. But the loss of income has many, many implications on women. In fact, I would call this the double jeopardy. You belong to the wrong gender. Being a woman is bad enough. Being a poor woman, that's terrible. If I add the triple jeopardy now, if you're an old woman and poor, you really have the triple jeopardy. You being a woman, being old, and being poor. So these female-headed households, these women who are heading this household, they had really many challenges. The first thing was the loss of income. They're not working anymore. And I think that label of, most of these were Malays, by the way. We had some Chinese, a few Indians, more Indians than Chinese. So this label about saying that Melayu malas ni, memang saya tak setuju langsung, because when we saw these women, they were working very hard. The men were working very hard. They were trying to make ends meet. I mean, they were working like 12 to 15 hours a day or looking for jobs, 15 hours a day just looking for a job. Now, the first implication that really saddened me when I saw these findings was the women are responsible for the meals and the food in the family. The overall intake has reduced. Memang menyayat hati, kan? And many of them said, we have reduced our intake of rice because we find instant noodles cheaper and easier to prepare. So rice intake has reduced. The amount of protein has drastically reduced, and the only protein they can afford is eggs, and that too not very often. So that is very, very sad. And now the children are out of school. Before, at least the children were in school, and if they're in the poor, low-income family, they get the feeding, the school feeding programs. Now the children are in school, they have to feed these children, they have to do child minding. The babies who went to babysitter, now there are no more babysitters, they have to be at home. And these children, they're supposed to do online education, but these are poor families. In fact, when I was the chairman of LPPKN, I interviewed some of my staff in LPPKN. Your children who are in school now, who are at home now, how many, because they said, doctor, my Dato, my daughter is on online education. I said, in your doctor's class, how many have the gadget, the laptop and the internet connection? 7 orang sahaja dalam satu kelas tu. So that's, I mean, I didn't ask how big the class was. I'm sure it's about 40, 50. So for poor families, online education is just not available. It makes me sad because now you really see the difference in the rich and the poor. I see my grandchildren, they're enjoying themselves. They go to private schools. They're online teaching. The teachers are so devoted. My grandchildren are enjoying their online teaching. And I don't see much compromise. It's really very good quality. But my heart really sings when I think of the poor families. The gap between the rich and the poor is just too much to accept. The other thing about this female-headed household that this finding that I saw in this study was the women, as we know, are the carers. Unpaid caring, unpaid care work. They care for the elderly, they care for the people with disabilities, and they care for people with chronic diseases. Many of them have husbands who are diabetic, hypertensive, on renal dialysis. So the burden is on the women. And I was very disappointed yesterday that the budget has been reduced for orang kurang upaya. The OKU budget has been reduced. And I think the OKU really needs a special extra attention. In the second study, this is the first study I'm showing you. In the second study, we have, the researcher has done a very good job of having asked questions on mental health. I don't have the time to discuss with you about that now, but overall, I can tell you the mental health status is quite worrying. There is already a lot of anxiety, there's already depression, and I feel particularly for the children, because children, maybe they can't express themselves very much, but I do know that some children have asked this question. I cannot afford this laptop, I'm missing school. What will my future be? How will I be? How will I compete with other children? And ada juga lah yang nakal-nakal maka oh bagusnya lah tak sekolah kan, ada juga lah agaknya. Tapi overall, I think children are undergoing a lot of stress thinking of their future. So the women are really having the extra burden of low income and the COVID and the MCO. Now the women are generally self-employed. The Makcik Kia, as Cik Nurhisham said, the goreng pisang seller, the nasi lemak seller. So being self-employed, social protection is hardly anything there. In fact, hardly anybody has got any social protection. Therefore, the government aid that is being given, the prihatin, the bantuan sara hidup is so very appreciated, so very precious to them. So a large proportion of them do avail of this bantuan daripada kerajaan, but to my disappointment, there were a few who did not. Not because they don't want, they were not aware that there was such aids available. And I think the government has to do a lot more on awareness giving. Now, talking about this social protection, because we've listened to the earlier two speakers who are the experts. I'm a medical doctor, public health specialist. I mean, insurance is something that I know very well. Social protection is something I know very much about. But these women who are unemployed, they are not socially protected. And it brings me to something that I really appreciated when I was still the chairman of LPPKN and Datin Sri Wan Aziza and Hannah Yo was still the minister and the deputy minister. I'm sure Datuk Norma, you remember this very well, the Suri scheme. And I was so enchanted with the Suri scheme. I think it's a beautiful scheme. A woman pays 5 ringgit a month and she is sincere enough to go on paying, the government will pay 40 ringgit, and so she gets 45 ringgit a month. And the third phase was even more enchanting, that the husband, who is also having an APF account, shall use 10% of his contribution. Betul kan, that one kan? I hope I'm right. 20%. Wow!
No, 2%.
Oh, 2%. Yalah, takkanlah 20%. Yeah? Okay, so bukan 10%. Yeah? So 2% of the husband's contribution will go to the wife. And I really celebrated that. I really liked that very much. And I'm sure both of you remember, maybe Nurhisham, you're too young to remember, this was like 30 years ago, when the Ikhtiar scheme was introduced following the Gramin Yunus punya dekat Bangladesh kan. And I remember going to one village and they were telling me the women who have to pay 50 cents a week towards this loan would queue up every Wednesday morning just to pay the loan, not the men. They took the loan and they ran away. But the women were so compliant. They were so honest. So I think women have a lot of potential in terms of being helped in such microfinancing scheme. So I think the Suri and the Ikhtiar, I found that as best practices that Malaysia can sell to other countries. Talking about other countries, I worked in many countries in WHO. I worked in Nepal, India, Bangladesh, Papua New Guinea, and lately Myanmar, and of course, even when I was there in WHO. And the CCT, the conditional cash transfers was so successful. I was part of the team to evaluate some of the CCT schemes. There's one called the Chiranjeevi in Gujarat in India. It's absolutely fabulous. The woman, this is for women only, by the way, it's maternal care. The woman can get this voucher from the government and avail of institutional delivery, because women were dying in India because they were delivering their babies at home. And the Gujarat scheme is different from the other schemes in India. The woman could go to a private hospital to get that care, and she still gets paid. So the CCT, I know is not here, and I saw when I was working in Myanmar, I've been going to Myanmar every year now for the last 7 years. And at the Nargis affected area, we introduced the CCT. Is very, very effective. Now the government aid, as part of social protection that was announced yesterday. I think they're just labeling things with different names. What used to be BRIM was BSH, now it become BPR, yeah? Bantuan Perhatian Rakyat. So we saw the amount that was given, nothing very impressive, but at least it's something. I think people are really happy with that one. Now, one of the interesting findings I found about this also was, I said earlier on, many of them avail of this aid, Prihatin, BSH, but you know what they say? Like the Chinese said, you can give a man a fish for one day, he eats fish, he eats for one day. You teach him fishing, he'll eat for the rest of his life. Now, this is an acute, debilitating emergency. We have to give them the fish. We can teach them how to do fishing, but we have to give them fishing. We have to give them the fish. And I reckon for quite a while before COVID really gets down or disappears. And the finding that I find enchanting was they express themselves. Memang kita suka sangat, kita berterima kasih mendapat bantuan ni. Tetapi ini yang bukan yang kita nak. They were very dignified. We want a long-term sustainable income generation activity. So I think that is something the government has to think about. So they were availing of prihatin, the rent exemption or something they appreciate very much. And the third thing, so number one was prihatin, number two was rent exemption, number three they appreciated was the bank moratorium. So yes, indeed, we need to give them the fish besides teaching them how to do fishing. Now, I think I have only 2 or 3 minutes left. I would like to just sell UNFPA again. Now, besides this that we did with the UN country team and this that UNICEF and UNFPA did, we in UNFPA at the very beginning, is sometimes in May and June, we started looking at the global trends and we wanted to see what it is like in Malaysia for other sexual reproductive health implications of COVID and MCO. Number one is, of course, family planning. They can't go because the clinics are closed. Even if the clinics are open, they need to go by bus anyway, and supplies could be compromised because of this MCO. The LPPKN were very good. When I was still the chairman then. When I called them, what are you doing about service? Oh, Dato, we are sending contraceptive pills to their house. We're sending them by courier. Wow, I said that's fantastic. So service was not disrupted. So number one, family planning. I'm very worried if there are unplanned babies after this, there'll be unsafe abortions. The second thing that UNFPA looked into, that we know that in the world, one of the biggest impact on women is gender-based violence. Domestic violence have gone up by more than 100% in some of the countries. So we have the global figures. I won't bother you with that now, but the increase is very dramatic. But we do have, we found out from the Women's Aid of WAO, when we call WAO confirmed with us. Let me check my data again. In 2 weeks in March, WAO said they registered 14% increase in violence against women. By the end of April, there was more than 200% increase in violence against women. So before I give my final comment, second to my last comment is, the irony couldn't escape me. Wawasan 2020. This is 2020. We were supposed to be a fully developed nation. Here we are. Of course, it's nature, it's COVID. We can't do anything about it. But we wouldn't have got Wawasan in 2020 anyway. But on a more positive and optimistic tone, I'm very, very thankful that the government is having now the shared prosperity vision for 2030. And I find 2030, that timeline is very, very significant. That's where our SDG horizon is. So we have 17 SDGs in the United Nations. I'm particularly responsible for SDG 3 and SDG 5. And I'm very glad yesterday, and I think one of the panelists this morning, I attended the morning session, Juwita mentioned about SDG, and she was thankful that yesterday there was some 5 million ringgit was earmarked for SDG, and for that I'm very, very thankful to the government. Finally, Washid, I know I'm taking a lot of time. I'm going back to the MOH budget. So the MOH budget, I think they're getting a very, very bad deal. Now, here I am with the two-handed situation. On the one hand, we are considered as having one of the best healthcare systems in the world, one of the most equitable, because I would say 3 things that have made Malaysia healthcare system one of the best in the world. The political commitment of the first 3 prime ministers. That political commitment was not empty words. Were it Tunku Abdul Rahman, Tun Hussein on, Tun Razak, Tun Hussein on. They translated the commitment into real gains, and I could build clinics all over the country. Today, you can say 95% of Malaysians live within 5 kilometers of a very well-equipped, well-manned clinic. No country in the world can have that. No country. I haven't seen a country like Malaysia where primary healthcare is that good. So primary healthcare is our foundation. So that's why. So that's on the one hand, we are very good, but that very effective, that very equitable, that very affordable system, is it sustainable? Is it efficient to begin with? I think it's not efficient, and it is certainly not sustainable. So on the other hand, we are I don't know why we have worked on this for 30 years. We are nowhere near the National Healthcare Financing Scheme. Maybe Dato Norma knows more about me, about the about the National Healthcare Insurance, National Healthcare Financing Scheme and National Insurance. Yeah. So these are my final words. Thank you, Wa Shin, for giving me so much time.
Yes, I think this is quite a good topic because I think that's a question on the national health as well. Maybe we can continue in our discussion. Thank you for highlighting, I think, a lot of the inequalities in terms of some which we actually do not know it exists, like digital divide, right? Like how the digital divide actually exacerbate the vulnerabilities of children, certain segments of the children, which we actually have not taken notice of until COVID hits, right? Thank you for highlighting that, and also the kind of vulnerabilities that in terms of gender disparities, in terms of when lockdown, what will happen to women as compared to men is different. I think in terms of loss of income, I think there are some studies to show that men experience more loss of income, but also more in terms of a social perspective, which affected women differently as well. Thank you. On that note, I just want to go back to Dr. Prof. Norma on a question on the national health. This is a question from Maslan. Any take from you on the announcement by government recently via the Deputy Finance Minister not to go on national health insurance as it is in need, especially during pandemic? Do you have any thoughts on that, Prof. Norma?
Thank you. Health is definitely part of social protection, and we've had discussions with the government. There are several models out there. I think the thinking is we have to reform our health system. Yeah, the universal healthcare, some reforms have to go in, but the how would I say this? That we there are, as I said, there are several models. We know that going for a true or the pure type of health insurance will not be necessarily good for Malaysia because of the inequalities in the country, and there are people who will be out of the net. But some of us are in favor of going for a single payer but many providers. Yeah, that but I'm not sure what is the thinking in the government currently. But certainly, we can't go on as we are now. I agree with Dato, Dr. Narimah. This is highly unsustainable and not necessarily efficient because there are too many people and there's so many issues with our public healthcare system. Although like Dato Narimah said, that we are one of the best in the world, yeah. But still, we have issues there. And also, we have practiced the dual. The private healthcare and also the public healthcare. Yeah. So for the economy, the private healthcare is also contributing. So going the middle way, yeah, one of the models is like the Canadian model. Going the midway perhaps is the way to go. But I think it's still at the discussion level. Yeah. Thank you.
Thank you, Prof. Norma. Please drop your questions in the Q&A box. Yeah, we will answer them as we go. Yeah, just to go back, I think there's a lot of interest in terms of informal sector. Just to go back on that. So there's a question from the attendee. What benefits do informal sectors view as favorable in social insurance, EPF and SWRC? Do the current social insurance schemes of self-employed individuals address their needs? And why is the take-up rate so low among self-employed? Maybe Nurhisham can address to that in terms of take-up rate, especially for, I think, the informal workers also.
Yeah. I think I actually had a webinar a couple of weeks ago that just purely focused on gig workers. There's one key issue, I think, for a lot of gig workers that makes it difficult for them to contribute, and that is that their income tends to be very volatile. Now, we used to thinking in terms of Grab drivers or what have you, so that one's fairly regular. But you can also look at, for example, the creative industries where you undertake a project, you might be paid after 3 months, right? So it tends to be very lumpy. It tends to be very volatile, and so that makes regular saving very, very hard because one, you don't know what your income level is going to be at any given time, and second, it's very uneven, right? So we don't have, we've been, we've done a bit of thinking in terms of how do we accommodate something like that. But, and we have our ISARAN program. We're also talking to a lot of platform players in terms of getting, for example, auto enrollment, so they can contribute as and when is. We're looking at things like micro savings. So, you can just put in a small amount for whatever transactions you have. So we need to open up more channels in terms of savings. We need to accommodate or design a system around their particular needs. Funnily enough, I think the biggest demand is actually for accident insurance, I think, more than anything else. Because especially if you're working for Grab, and you're always subject to that possibility of getting into an accident, what have you, that might really jeopardize your ability to earn anything. So that has, the take up there has been fairly good. But for retirement, it's a bit harder.
So on the retirement side, I think there are questions about what are your thoughts on reforming the retirement system altogether? What needs to be changed from the current practice to make it more sustainable? Okay, so best practice, I think, for example, like we have in Japan or in Europe, is that you have a multi-layer system. There needs to be a basic social tax finance social pension that covers everybody. That's the bare minimum. And then you build on top of that. You'll have your discretionary savings. You'll have your sector or industry level savings based on what kind of employment you have. And we need to have some form of portability between the different systems as well. But that's a very big institutional reform, and it will take time to do.
And Ya Shin,
yeah, maybe Prof.
Question number 2 that Hisham has addressed earlier. If I can just add to that, then
Yes,
I think
sure.
what's positive with this budget is how social insurance, especially the accidents, to cover accidents, work injury by SOCSO, is extended to groups like RELA, the Grabs, and again, just as Hisham said, it is very employment focused, is employment oriented. That's what our social protection is. But what's good is for the these groups that have not been covered before. Like I said, the net is discussed wider, that more are included into the work injury. So that's the one. And on the retirement, there's also another question that asks whether we should look into splitting the EPF into the retirement into annuity. Now, when there are different types of cash assistance. One is when you give lump sum, and the other one is you give monthly. And as evidence, and I think many of us are aware, that when you give poor people some cash, quite a bit of that at one time, the propensity to consume or to spend almost immediately or to spend is very high. Whereas if you give them like every month so that they can plan what they can use it for, so it's one of those that would be, as evidence out there shows, that is better. So when we're talking about benefits and talking about retirement, the annuity scheme, which is monthly payment, monthly type of pension type of thing, is something that we are talking to the government, because as many of you are also aware that there is a council called the Social Protection Council, that was established, and I'm part of the team looking into this. So we are proposing to the government that we should look into annuity, converting part of the EPF contribution plus. So that's where I call the synergy, that between contributory, that everyone should contribute, everyone should be responsible, either for retirement or when there are bad times in order to support them during crisis. But at the same time, the government too will have to play its role. So also, Ya Shin, if I can touch about among the broad questions that you put forth was about the cooperation and collaboration. And I want to tie in with what Isham was saying earlier, yeah? That with COVID, the NGOs, the civil society organizations and all that, they're very active out there, yeah? And in our social protection, the providers of social protection is not just the federal government, but it is also the state government, the zakat at the state levels and all that are very active. So now is the time. If we want to consolidate data, this is the time that we can. Although we also have another proposal that if you use a different approach, which is used elsewhere, using the life cycle where you support the categories of the society, then you have another option, which is my card, yeah, which can be used. And I would like to talk to you about that in a bit. But the collaboration that now we are seeing that's happening, and the government is actually leveraging this collaboration in this budget, because they are also going, using civil society, using NGOs and all that to deliver. But it can be also for getting to improve the databases. So there are questions like whether is IKASE and the LHDN is the only database we're using, but I think now people have their own databases. Yeah, so this is the time that the government, a central agency like the either DOSM or Kementerian Wanita, yeah, could use this opportunity to integrate all these databases so that we have it in one and we can add it on, clean it, and all that when necessary. Yeah, so that is about the data.
Yeah,
So
thank you.
I'll
I think that's a very interesting point, because it's like a few points coming together. One is the data, the problem of not unconsolidated, like fragmented database, and also the problem of coordination, not just the government, but also the civil society as well, coming together to consolidate that data. So I think on that note, in terms of the coordination, how maybe Dr. Narimah, what do you think in terms of, would that help in terms of the lack of awareness that you were talking about just now? Like how do we reach out to the people better? Because I understand now different ministries also have their different database as well. I think primarily IKASE is the main one, but of course NGOs also have their own clients that they serve as well. What do you think could help to enhance the awareness of what's out there to the people on the ground?
Okay, that a lot of things are in that question, Washin. The first one is I cannot agree more with Dato' Norma about collaboration and cooperation. So the intersectoral, interagency collaboration is absolutely crucial in trying to, number one, to get data, because I think while DOSM does a lot of good work, but we still have, for one thing, we don't have gender disaggregated data for a lot of things. We cannot see how much is it for men, how much is it for women. And on awareness, Washin, I hope I'm not being overcritical here, but having worked in so many countries in the world, in this region especially, I find health literacy in Malaysia is lower. I find trying to give awareness to Malaysians a lot harder than to those other people I meet in other countries. In those other countries where literacy rate is low, and yet people listen to you, they are aware of their health. I'll give you a very, very simple example. My mother-in-law, she's no more now. When she was alive, I married somebody from India. My mother-in-law, when I wanted to give her antibiotics that was like every 6 hours, she made me put an alarm clock. She said, I want to take my antibiotic on the dot of the hour. I mean, she was that health conscious. So, well, Malaysians are very difficult. I find that, you know, despite being educated. I'll give you another.
So what would be some of the solutions that maybe from other countries in terms of how to address
let me write that one first, because I want to give you another example. This example, I'll take another 2 minutes. I was in a longhouse in one interior village in Sarawak. My nurse was taking pap smear on the floor. It's back-breaking work. The women, the Iban women were queuing up. I asked them, kenapa kamu buat? Tak tahulah doktor. Kamu kata benda ni penting. Kalau doktor kata bagus, mestilah bagus. They don't know cervical cancer. They don't know what the pap smear is all about. But they will do it because we say so. I have educated women say maybe in KL, in Damansar Al-Haj, so don't go for a pap smear. So literacy has got very little to do with that in the Malaysian context. So to answer your question, Washid, we had once upon a time, I don't know why the previous government got rid of, they must have their reason. They held the Health Promotion Board. In the Health Promotion Board, you actually take the syntax. We learned this from Thailand and from Victoria in Australia. And I'm sure Norma knows about this very well. So the syntax, the text you get from tobacco and alcohol and all the sins on gambling, put it in a coffer and do health promotion with it. The Thais are very successful. So we promoted it in Malaysia. It was set up, but I was told it's not there anymore, the Health Promotion Board. Maybe they have another body that does this, but maybe there was mismanagement. I really do not know. So Washid, we got two strategies already. Number one is intersectoral collaboration. Number two is, I think what Norma mentioned earlier on, community participation. The communities, there are a lot of community leaders, you can use them. India is very good in this. I use a lot of community leaders. And number three is bring back the Health Promotion Board to do health promotion.
Yeah. Thank you, Dr. Narimah. I want to move into the budget a bit to discuss on like some of you or most of you have actually generally what your perception of the budget is for social protection. Just want to go back to what Encik Nurhisham was saying on the budget, with lots of things in the budget, but it's more on an ad hoc basis. I think one of the questions I think is basically in terms of withdrawal from account one. What is your opinion on that?
Okay, I think we're in a bit of a difficult spot in terms of we recognize that our members are in a difficult position, or at least some of our members are in a difficult position. But we also have our mandate that we're supposed to look after their future, not their present, right? So we're trying to find that middle ground where we're trying to help out as much as we can and stretch out whatever is available as much as we can. Because the reality, I think Prof. Norma mentioned 70% of EPF members have less than 50,000, but 38% actually have less than 10,000. So allowing further withdrawals could run the risk of basically people running out with savings entirely, and then what? Because we don't know when this crisis will end. We don't know when we will have a viable vaccine that can be mass implemented across the whole country. So we still have to keep a little bit of a buffer, because people will need it down the road, we think.
Yeah.
So
I was very unhappy about that withdrawal of EPF announced yesterday. I think, I mean, what happens to your old age? That's where they need it most. Yeah. I think withdrawing EPF, I don't like it.
Prof. Norma, do you have any thoughts on that?
Yeah, I think when it is about short term and long term, yeah, and long term you're talking about structural issues that you have to address, and we do have serious structural issues here. When you yield to demands, yeah, we can understand, but there are other ways. There are the government. Whether you like it or not, whether the government has the fiscal space or not, there are ways. You are the government. It's the fiscal that's facing, is the government that's facing the deficit. There are a lot of surplus in the private sector. Yeah. So Malaysia is not, what we're facing now is not like what we were facing in the 1980s when we had twin deficit, when the private sector was also owing foreign organizations, foreign banks money, So even when we borrow now, we borrow internally, and we pay the rent, or rather the interest for the money that we borrow to our own people. Yeah. So I have issues with withdrawing from account one, although they make it very strict. that is only when you lose your job. But nevertheless, you know, it was created for a different mandate. Yeah, we do not want our people to be going to loans and all that. But interest-free loan, if people really need it, maybe a monthly cash transfer for really like bottom 10% or you know, and like I said, our databases, although it is not at one place, yeah, it is not integrated, but more people know. Like Dato, Dr. Narimah was talking about that 500 households that she's looking at, and there are so many out there that people know now who are the people who are really suffering. We don't have it at our fingertips, but if we talk to people on the ground, we can reach out to them. Yeah, and yeah, so that there are issues out there that people forego eating because they don't have money for the rent. Yeah, because these are the urban poor when they have to pay rental. Okay, so or rental on rental. So there are issues out there that I think, if anything that comes out of this pandemic, is for us to really take a closer look at the structure of our economy, the structure of our livelihood and life in Malaysia. Yeah.
Washin,
Yes.
I am very interested to know Dato' Norma's opinion on something. Many people have asked me this. They kata, Dato', the people who are really suffering are these poor people, self-employed people. Government servants are not affected at all. They still have their jobs. Can they take a pay cut? Can the ministers take a pay cut? It's not such a crazy idea, is it?
Exactly.
For government servants to take a pay cut now and put it in a coffer?
Like I said, you know, there are options. There are options. Yeah.
And that is one option.
Yeah.
Viable.
So, Prof. Norma, just on your thoughts on the budget as well, like besides this point, I think this is just one of the points, the measures as well. In terms of the general, like the kind of budget for social protection in 2021, what are your thoughts like generally? Like, is there anything that can be improved on, or any good highlights, you know, that you feel like it is a very good move, basically?
Okay, at the onset, yeah, I did mention about there's some good elements. Yeah, the good elements, if I can point it out to you, aside from increasing the payment, yeah, would be like breaking down into households, not looking at every household is the same. Yeah, so now you have, if you have one child, you know, it's a different amount. You have two children, it's a different amount, 3 children. And also, children at the age of 7 years to 18 years old is also given some support. Yeah, but it's to a maximum of 1,000 ringgit. So these are some of the elements that we have been talking about to the government as well. Yeah, like I said, more can be done. We would prefer for the government to see more of the life cycle. When is it vulnerable? Yeah, as an infant, maternity. I think Dato' Narimah would be very familiar with this. Yeah,
yes.
When are you vulnerable? Yeah, you're vulnerable when you are in maternity. Maternity is not just about vulnerability, but about our future, the nation's future. If the fetus is not healthy, yeah, then and also young children for 1,000 years, 1,000 days and younger, you know, their cognitive development depends on the action that they take. So if we don't take care of this group now, we're not going to have 5 Malaysians 30, 40 years from now. Yeah. So we're talking about a high income nation. And our study in Malaysia Aging Retirement Survey did a comparison between Asian countries. My colleague, Professor Ogawa from Tokyo University, and myself, we did a comparison between the Asian countries that at the age of 60 or 60 and older, what is the cognitive function? And the results shows that education and good nutrition is one of the contributors towards cognitive ability or cognitive function in the old age. So again, if I can come back to the life cycle, the maternity, children, very young children at a certain age, but also many children are dropping out from school.
Yep.
So if you start now giving children until 18 years old, this is how, when we measure the Human Development Index, we are still using the 12 years of education, whereas we should be talking about until they are 18, until high school. For Malaysia, because we are an emerging high-income nation, so we can indicators that we use when we were low income. So
I think, on that note as well, Prof. Norma, I think there's a question from the participants. Do you think Malaysia should pursue universal coverage or more life cycle approach? And which is the priority group, if so?
Yeah, indeed.
Generally,
very much so, Ya Shin. And I'm not talking that you do one shot. Although we have looked at the numbers, we can, because like I said, there are 3 guiding principles. You go either coverage, you go adequacy, or you go for the cost. Combining the 3, getting the mix of the 3, we feel that we as a country, we can cover all the life stages that we're talking about. The last stage will be the social pension that Hisham mentioned earlier. We can, but whether and as I said, if we can't, there are ways. If we can't do it universally, but to me, especially now with COVID, there are ways of. I don't want to use the word targeting, because targeting usually would exclude the poor, the illiterate, the non-digital. I'm talking about excluding using administrative data. If you want to give only to the 60% and below, or you want to give to bottom 40% to begin with, we can use, the best way is to use My Card. So when you are, every Malaysian has the My Card. You can use that to get your money. Government can use that to transfer the money. And for those who are in the top 40, they go to any BSN or any shop, they want to use the My Card. The money is just not there. So they will have to prove that they are entitled to this fund or to this social protection we're talking about. So that's the kind of universality that I'm talking about. It is not necessarily covering everyone, the rich and the poor. Maybe we can't afford it now, although we think that we can. Although when we are doing the work, we are doing the actual mathematics of it, we feel that we can, depending on, we should prioritize, and we should also integrate some of this and see where are the wastages. Because the administrative cost of going to every household and checking whether I can tick this box, whether they fit into this box and all that, is higher. Is about 11%. 11 to 13% goes to the administrative cost. So that 11-13% can easily cover 60% of the categorical targeting that we are talking about. So so I hope more of us are talking about this. But I'm glad, like I said, I can see the elements, I can see the foundations and the science that social protection is no more the taboo that Dato, Dr. Narimah was saying. How can we can be talking about giving the rod, not the fish, or teaching the people to fish, but if they are disabled, if they are old, how are they going to fish? And if they are carrying maternity, pregnant, how are they going to go and fish? So these are the kind of issues that I think we have to talk about. And I think the more people or groups are talking about this, the better it is. And I think this is the best time. Let's not waste this crisis, and let's not waste this time and opportunity. Thank you.
So on that note, I just want to ask Ichin or Hisham, because you mentioned just now talking about ad hoc basis, right? Because we addressed this whole situation on ad hoc basis because of the lack of mechanism, the lack of database. So on that note, do you, in terms of what could be done instead? And also, I think your point on most of our social protection is employment based. So what about those who are not covered? Do you think, what are the things that we can kind of expand into?
Okay, I think we really do need to look at entirely changing the basis of our social protection system. It needs to be all Malaysians, not just those who are employed. And we see that with other countries as well. I mean, we have this controversy around Medicare around in the US, and there are so many people who aren't covered. Whereas in our system, of course, it's entirely universal, and regardless of your situation, you have access to excellent healthcare. So we really need to have, as I said, I think really need to move towards a more multi-layer system where there is a basic, not just in terms of social pension, but also in terms of unemployment benefit that will cover everybody, not necessarily to an adequate level, but at least we would solve the coverage problem, right? And then you would have multiple areas on top of that, depending on what your employment situation might be. So we would have a multi-layer system rather than a single tier, very narrow kind of system that we have today. And I think that's where we really need to move towards. But obviously, that will require a much different type of institutional arrangement. It will require, I think, a very different approach to the legal aspects of it, for sure.
I just want to go further into informal sector workers. Like, what are your thoughts on that? Like, how could we include them? Because I think one of the major vulnerable groups that we have seen during COVID is basically this informal sector workers. And what you have mentioned as well is difficult to reach them because they're not in database, they're not in other EPF, or maybe some of them are registered under SOCSO, but most of them are not. Yeah. So how do we extend the coverage to them? Especially like this kind of ad hoc, like we need to respond fast. Yeah.
I think there's a number of models. One, I think if you could go the Singapore model where everything's mandatory, regardless of what you're doing. There is a more softly approach like what Korea does. It's also largely mandatory, but they try to persuade people to join the system. You have multi-layer systems like they have in Japan and for example, Denmark or the Netherlands. So there's a variety of models for us to look at. I think one, I would say, key factor here is that regardless of which model you're looking at, it has to be both tax finance as well as contributory, right? But that brings in the larger conversation into the conversation. Okay, how much are we willing to sacrifice to have a system like this? Are we willing to have GST at 15%, for example? Are we willing to have 50% income tax brackets, right? And you know, I think that conversation has to happen. We have to. It's really something like a very much a new social compact, you know, that we have to come up with. And I think the silver lining here, and I hate to say there's a silver lining to COVID because it's been such a disaster for everything. But at least people realize the importance of us as a society looking at it as we rather than me, right? And that whatever system we come up with, it has to be something that everybody contributes towards together rather than having to rely on our own selves.
Yeah, I think there's a question about the effectiveness of having social protection number for all Malaysians in preventing any unnecessary coverage. What do you think on that? Just maybe a quick one because we are running out.
We've got a My Card, right? Everybody's got essentially an identity card that says you are a Malaysian, right? So I think all hinges on that. You know, that card alone is so powerful if we knew how to leverage it. And you know, we don't have to have separate social security numbers. The problem now, we have a separate LHDN number, we have a separate SOCSO number, we have to have a separate EPF number. You have to fill out 3 different sets of forms. You know, I mean, you're a citizen. You should have, you know, those rights, and the government should be able to deliver to you because they know who you are, what they're supposed to, right? And I think that's an important. I think that is an important tool that we have really not utilized as we could have.
Thank you. Yeah, I think we're running out of time.
Okay.
Yeah, just maybe for all the panelists to make your last remarks before we close. And we can start from Dr. Narimah to Nurhisham. We reverse the sequence to Prof. Norma. Yeah. Dr. Narimah, over to you.
Okay. So my closing remarks is really commenting on what Prof. Norma has very, very eloquently said. She doesn't like the word targeting. In fact, one of the recommendations UNFPA made on this report, Dato' Norma, is that we would like to have social protection to be targeted social protection. Anyway, I know what you mean. And by the way, just to remind you that SDG 3 is expressed as health and well-being throughout the life cycle, and all the 17 SDGs, the underlying principle is universal health coverage or universal coverage. So UHC is already worked into the SDG, so we don't have to worry, because there was a question about universal health coverage. And by the way, about the age 18, we are a signatory to the Convention of the Rights of the Child, and that ends at 18. A child is until the age of 18. So there are a lot of things that we need to do on that ground. My final thing is what earlier on Dato' Norma said about the health system. Yes, there is no perfect health system in the world. And I like your comment about taking the middle path, Dato', about we now have the dual system of the public and the private. I wouldn't want to call it the middle road. I want to call it, if there is a health insurance, I want to have a very good one system, a merging of one system. In other words, if I pay insurance, I want to have the choice. I go to Hospital Selayang, I pay 300 for my appendectomy. I go to Ampang Putri, I pay 700, but it is co-payment. I go to JHKL, I pay 80 ringgit. So I want that client to have that choice. I want to choose which hospital I want to go for, and I'm willing to pay the co-payment. So I like the comment you made about let's do something about this public-private dual system. Thank you very much, Washin, for giving me this opportunity.
Thank you, Dr. Narimah. Encik Nurhisham.
I think I've said a lot already. Yeah, so just to maybe wrap up, one is that I think we need to have a serious look at reform of the social protection system. I think the need for it has become very clear. I think you know, the public awareness and acceptance of that is also, I think, rising. And I will try to end. Okay, I'll end with one plug. The EPF is currently doing a public consultation, because I saw a couple of questions on having an account 3 or different sets of accounts. Well, we're asking you to give us your feedback. The survey is at survey2020@kwsp.gov.my, and we would love to hear from you.
Thank you. Prof. Norma.
Thank you, Yashin, and for me to be the last speaker. Now, I would concur with Isham about we have the My Card, social protection should cover everyone. The moment they reach 18, it should be mandatory that they contribute. For the low income, the government can contribute. So it should be a mix of contributory, individual contributory, because everyone has to feel that they have to be responsible for their future, for when it needs to be protected. But at the same time, the government will have to spend as well, which is tax funded. Now, talking about the government, one cannot talk about expenditure and social protection without talking about the revenue. So Isham has touched that a little bit. Now, we are talking about whether we have to talk our tax reform. What is the format? What will be the approach? What's desirable by the people? I think it is up to the people, but we have to. It cannot be. It was reduced from when we had the GST is about 13.5% to the GDP. That's the tax to GDP. And then we had 12.5%. And with the current for 2021 is going to be 12%. You're talking about OECD countries, 30% to the GDP. Yeah, tax to GDP. So it has to be some kind of progressive. If you don't like GST is supposed to be regressive, but our GST has numerous, countless exemptions and zero rate. But if you don't like that, then we have to go for progressive type of a tax system. So my take on this is that as a nation, I think we have felt. We know how other people are feeling. Maybe we don't feel it because we are not in it, but we know now because it's not coming from just one sector, but coming from everyone. and also we know who they are as well. So let's get our forces together. Let's put our ideas together and think as a society, yeah? Because social protection is not charity. Social protection is solidarity. It's part of the development process. So we cannot avoid it, yeah? So thank you very much, Ideas, for organizing this. I think we should, and especially among the young, you have to think about when you retire or when you are sick or when something like this happens, how prepared are we as a person, as a society, and as a nation? Thank you very much.
Thank you, Prof. Norma. I think Prof. Norma have wrapped up very beautifully in the sense that I think despite having COVID-19 is not something good, but from this we actually have seen how change of perception of social protection, and also the discussion of how can we be more resilient in the future if there's a crisis to happen. I think these are very good conversations. As Malaysia do not have a social protection law, we do not. It's time to start this national conversation on what do we appreciate as a nation, what is the basic social protection that we actually want as a society. I think those are very good conversations. And the panelists have put forth a lot of good comments, thoughts on how can we enhance the mechanism, how can we expand the coverage. Also, I think in terms of the partnership, not just the public, but also the private, how do we not only consolidate the inter-ministry database, but also to work with the private sector and also with the CSO as well. How do we come together to ensure that the nation is protected in the event of another crisis or to come? So thank you all for joining us today, and thank you to all the panelists for their contribution, for the insights. It's very helpful and very insightful. Thank you all for spending this time this Saturday afternoon with us, and we will see you